Good morning, everybody, and welcome to Responding to Traumatic Brain Injury. My name is Mark Long, President of Comprehensive Elder Care Solutions, CompECS, and I will be your instructor for today. As already described, guys, all of you attending live, you will be receiving a certificate of completion. In addition to that, I will be providing your administrator with a video recording of this. So this training is being recorded so that your other employees are able to participate in the training via video as well. With that, just a little bit about me really quickly, guys, just so you know who's in front of you. I've been in the senior living industry for 20 years. Actually, just February marked my 20-year anniversary. And I operated for 13 years. I operated larger buildings, kind of like some of you, like Fremont Village is one of our larger buildings. I operated buildings like similar to Fremont Village for about 10 of those years as an executive director. Now I do a few things in addition to teaching CEU classes and consulting and instructing. Part of my role, we assist communities with the assisted living waiver program application. And that's the primary focus or reason for this training. It is a requirement in order for all of you to be able to provide care and supervision to individuals with traumatic brain injury. And so let's really talk about what we want to cover for the next, 45 minutes to an hour or so. We're going to be discussing traumatic brain injury. We want to gain a general understanding of it. We're going to identify the various causes of TBI or traumatic brain injury, recognize common symptoms of TBI. We're going to discuss supervision and common care interventions and techniques and approaches to the person with TBI. And then also, we need to understand some of the risks and liability that come with it. And so we're going to jump right in and even before I get started, I want you guys to understand, when we hear traumatic brain injury, you may be looking at your administrator like, are we really talking about, possibly taking care of people with traumatic brain injury? The answer is yes. And to relieve, your mind, ease your mind if that worries you at all, keep in mind that traumatic brain injury really is another type or it's another cause of dementia. And most, if not all of you, you provide dementia care every day, all the time. You do it all the time. What's interesting about the different types that you may be familiar with, different types of dementia, like Alzheimer's disease, like Lewy body dementia, maybe frontal temporal dementia or vascular dementia, right, from stroke, is that we tend to, those, especially the degenerative diseases like Alzheimer's and Lewy body, they have this natural progression. So we really know kind of what symptoms they're going to have. We kind of know what order those symptoms are going to come in as they progress through that disease process. We can kind of anticipate what's coming next. Well, traumatic brain injury, even though yes, it is just another cause or type of dementia, the symptoms are going to be dependent on the part of the brain that gets affected. So if the person's in a car accident and they damage the front part of the brain, the frontal lobe, we might see one set of symptoms. Whereas if they fall, slip, and hit the back of their head and get brain damage there, then we might get another set of symptoms. So, and we'll talk about that in more detail, but I just want to reassure you guys, number one, that your administrator, your leadership team is never going to move somebody into your community that you can't handle, that you can't meet their needs, okay? Because that's actually a regulatory requirement, is that you have to be able to meet their needs. And so if as your administrators accept, residents with TBI, know that it's because they are already confident that you're perfectly capable and well trained and well experienced to be able to manage that, to handle that. Okay. Again, if hopefully by the end of the training, you'll also feel a little bit more comfortable about the condition itself and the people that you'll be serving. So let's start off with a what I call an operational definition of traumatic brain injury. Okay. TBI is an injury to the brain caused by an external force, such as a forceful bump, a blow to the head, jolt to the head, or even the body, or it can also be caused by an object entering the brain. Now, not all blows or jolts to the head result in TBI. Most of us in our lifetime, we've bumped our head before. Okay, so it doesn't necessarily cause traumatic brain injury. This injury can result in temporary or permanent damage to the brain, which can affect cognition, physical attributes or physical symptoms, as well as emotional functioning, right? Think about it. Our brain controls everything. Our mood, our behaviors, even our physical movements, right? It's all controlled in the brain. Now, more serious TBI, of course, can lead to severe and permanent disability and, of course, even death, right? So what I want to do is I want to start off with this short video. It's less than 4 minutes. Traumatic brain injury causes, symptoms, diagnosis, and navigating the landscape. And it's just kind of an overview. It's just kind of an overview of the condition. Okay, so here we go. Traumatic brain injury causes, symptoms, diagnosis, navigating the landscape.
Today's medical-centric topic is traumatic brain injury, causes, symptoms, and diagnosis explored. Traumatic brain injury, TBI, is a complex medical condition caused by a blow or jolt to the head. This video delves into the causes, symptoms, and diagnostic procedures of TBI. 1. Understanding traumatic brain injury. TBI is an injury to the brain caused by external mechanical force, potentially leading to permanent or temporary impairment of cognitive, physical, and psychosocial functions. It ranges from mild, a brief change in mental status, to severe, an extended period of unconsciousness or amnesia after the injury. 2. Common causes of TBI. The most frequent causes include falls, vehicle-related collisions, sports injuries, and violent assaults. TBIs are also common in military personnel due to explosive blasts and combat-related injuries. 3. Recognizing the symptoms. Symptoms vary and can include headaches, confusion, dizziness, blurred vision, ringing in the ears, fatigue, behavioral or mood changes, and trouble with memory, concentration, attention, or thinking. Severe TBIs can result in prolonged unconsciousness, coma, or even death. 4. Mild or severe TBI. Mild TBIs, often referred to as concussions, typically result in short-term symptoms. Severe cases may lead to significant physical, cognitive, and behavioral impairments. 5. Immediate responses to a suspected TBI. Immediate medical evaluation is crucial, especially if symptoms worsen or new symptoms develop. Emergency care is essential for severe cases marked by prolonged unconsciousness, seizures, or repeated vomiting. 6. Diagnosing TBI. Diagnosis involves a neurological exam and imaging tests like CT scans or MRIs to assess the brain's condition. The Glasgow Coma Scale, GCS, may be used to determine the injury severity based on conscious response. 7. Long-term impacts. TBI can have lasting effects on physical and mental health, employment, relationships, and daily living. Rehabilitation services, including physical therapy, occupational therapy, speech-language therapy, and psychological support, may be necessary. 8. Preventive measures. Prevention includes wearing helmets while biking or playing sports, using seatbelts in vehicles, and creating safe environments to prevent falls. Education and awareness are also key in reducing risks and understanding the importance of protective equipment in high-risk activities. Traumatic brain injury can have significant consequences on an individual's life. Understanding its causes and symptoms, seeking prompt medical attention, and adhering to preventive measures are critical steps in managing and reducing the impact of TBI.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated.
They always got to throw in that social media stuff at the end, right? Like and share, like and share.
Today's medical.
All right. So some injuries are considered, when we're talking about TBI, some injuries are considered primary, meaning that the damage is immediate, while others can be secondary, meaning that the damage actually will gradually over the course of hours, days, even weeks after the injury. Okay. So these secondary brain injuries are the result of reactive processes that occur after the initial head trauma. So what happens is sometimes our brain, from the initial damage, our brain is actually responding. And so, there may be inflammation. I mean, there's all kinds of medical responses that our brain can take, or actions that it can take in response, and this can occur over time. So what's important for us to understand, and the reality is we're not providing acute care, right? To that person that just hurt themselves, that just got the damage. They're going to be in the hospital. They're going to be treated in the hospital. They're going to be treated in a skilled nursing, or rehabbing in a skilled nursing before they come back to us. Now the exception to that, and this is where this is important for you as caregivers to understand, is that concussion. Concussion is a form, even though it's temporary, generally it's temporary, it is a form of traumatic brain injury. And so you do, as a team providing care and supervision, you do need to be able to recognize the signs and symptoms of concussion and recognize that. Again, coming back to TBI, we know that there are two broad types or categories of head injury. There's what we refer to penetrating and non-penetrating. And it's actually kind of self-explanatory, right? Penetrating, also known as open TBI, this occurs when an object pierces the skull and enters the brain tissue. Penetrating TBI typically damages one specific part of the brain. That's a typo. Got to fix that. One specific part of the brain, which is, right, the part of the brain that the object entered, where it entered. So examples could be things like a bullet, shrapnel. If you're not familiar with that term, for the longest time, I thought that was scrap metal. It's actually shrapnel. And shrapnel, it can be metal, but it's basically the flying objects from an explosion. So fragments, right? Metal, could be the bomb fragments itself. It could be other objects that are flying through the air as a result of an explosion. So that's shrapnel. It could be bone fragments. Okay. And then think of like construction sites. It could be things like a nail or rebar. Okay. Things of that nature. Now, non-penetrating, also known as closed head injury or blunt TBI, is caused by an external force that's strong enough to move the brain within the skull. Causes include things like falls, motor vehicle crashes, sports injuries, blast injuries, or being struck by an object. So, guys, our brain, right? I don't know how many of you like to eat tofu. Well, our brain is about the consistency of tofu. Okay. Now, our tofu brain, is protected by our bony skull. And so what happens is we actually have a fluid that protects, it kind of bathes the brain and it protects the brain from the skull, from the bony structure of the skull. That fluid is called CSF, or cerebral spinal fluid, CSF for short. It's a little bit easier. But what happens is, even with the CSF kind of bathing and protecting the brain from the skull, when we hit our head, if the blow is hard enough, then even with that CSF, the brain can be damaged. Now, what's important to understand and recognize, at least acknowledge, with non-penetrating TBI, oftentimes there's no physical evidence on the outside. Yeah, there may be bruising for a while, but once the bruising heals, a bump may go away, or there may not be a dent. So just because you can't visually see damage to the head, it doesn't mean that the person doesn't potentially have non-penetrating TBI. Okay. And then, as mentioned, causes, examples, things like falls, motor vehicle crashes, sports injuries. Think about football, right? Colliding heads, even with a helmet, your brain is rattling around inside there. Blast injuries, or being struck by an object. Okay. So who is most likely? Who's more likely to get traumatic brain injury? Well, the most common causes of traumatic injury actually tend to vary by age group. And it kind of makes sense, right? For example, for older adults, falls tend to be the most common cause for seniors. Falls and child abuse, unfortunately, are the most common causes for infants and young children. Whereas for teenagers and young adults, think about what they're doing, right? They're more likely to experience a sports related or a vehicle related injury. Okay. So statistically speaking, older adults, especially age 75 and older, now those are your clients, right? They're at greatest risk. So of the entire population, older adults 75 and older are at greatest risk for being hospitalized and dying from traumatic brain injury. And the most common cause amongst seniors, the fall. Okay. So if you've ever if you ever get tired, or if you ever wondered why your administrator, your executive director, why your leadership team is always, why are we always talking about falls? Why are we always doing fall training? Preventive, fall prevention. That's why. Now you know why. Because falls are the most common cause of TBI, and it happens so frequently amongst our seniors that it's a serious risk factor. In every age group, serious TBI rates are higher for men than they are for women. Sorry, guys. We just live, I don't know if it's because we live life a little bit dangerously, if we're less safe than females. I mean, I've got some other ideas that aren't quite as nice, being a guy myself, you know. But yes, men are actually more likely, they're 3 times more likely to die from traumatic brain injury than are women. Okay. I think it's also, come on, real talk. I ran buildings for 13 years. Men, right? No, I'm not going to use the walker. No, I refuse to use that walker. And so, I mean, there's a whole slew of reasons why men are more likely to be injured and unfortunately die from TBI than are women. Okay. So talking about the statistics, guys, roughly 1 million Americans are treated and discharged for traumatic brain injury and concussion in emergency departments every year. That's a million in the United States, approximately 1 million every year. Approximately 230, that's almost a quarter million people. Almost a quarter million people are hospitalized, but they survive. They're hospitalized, but they're survived from their TBI. And it's estimated that about 50,000 Americans die each year from TBI related injuries. As we mentioned, older adults have the highest incidence of TBI due to falls, and they count for almost a third. Of all the incidents of TBI, older adults account for almost one third of that. Then the next group or population are the young children and ages 1 to 4, and then adolescents 15 to 19 are the third highest, have the third highest rate of TBI. So let's talk about some of those. And I think we've covered already some of these. So I'll keep kind of moving through it. We know that the leading cause is falls. According to the CDC, the Center for Disease Control, falls are the most common cause of TBI and occur most frequently among the youngest, right? The little ones, 1 to 4, and the oldest. Blunt trauma accidents. These are accidents that involve being struck by or against an object. Again, sports-related injuries fall into this category. Vehicle-related injuries, and that includes pedestrian-involved accidents, right? Car versus pedestrian, if you've ever heard that term, as well as accidents involving motor vehicles. Now, that could be anything from motorcycle, that could be bicycle, that could be skateboard, that could be scooter, okay? They are the third most common cause of TBIs. Assaults and violence. We don't talk about this. We don't think about this one very much. But yeah, abuse-related TBIs are head injuries that result from intimate partner violence, like domestic violence, assaults, shaken baby syndrome, and wounds to the head that are caused by gunshots or other weapons. So violence. Sad, but hopefully we don't think about those in our communities. We shouldn't have to think about those in our communities, but even assaults, especially when we're dealing with dementia. We do see occasionally, hopefully not very often, but we occasionally see, the physical aggression. And then explosions and blasts. And I typically think of our military when I think of these. I can't think of, I don't know, maybe construction, but TBIs caused by blast trauma from roadside bombs have become a common injury to service members in military conflicts. The majority of these TBIs are classified as mild head injuries. So, in other words, thankfully, we tend to see more like concussions, which are short term and temporary. But obviously, long term, damage and even death can occur with these explosions and blasts. All right. What are some of the common symptoms, right? Symptoms of TBI can vary greatly from person to person. The part of the brain that is damaged will be the primary factor that determines the symptoms. However, just as just as our personality is unique, the symptoms of TBI will also affect each person differently as well. And this is where, so, going back to what in my introduction, I was kind of talking about with some of the other types of dementia. Let's take, for example, Alzheimer's. Okay. What do we know about Alzheimer's? Alzheimer's starts in the hippocampus. So what does that tell us? That means that usually the earliest signs of Alzheimer's is going to be short-term memory impairment. And then it's going to move into attention, right? Into the part of the brain that focuses on our ability to attention and in our attention span. And then it'll affect language, where maybe we can't remember the name of common items and things like that. So there's a very specific path that Alzheimer's takes as it progresses through the brain. So we can anticipate what symptom we might experience next. What I guess one of the key messages, one of the key things that I need all of you to understand by the time you walk away from this training is that the symptoms you're going to experience or that you're going to see from your resident with TBI, first and foremost, is going to be determined by where the damage to what part of the brain is damaged. And it's unique. It will be unique for every person. And even if you have, if you have five, even if you had like 10 residents all with TBI, and let's say they all were involved in a car accident that hit the front of their head, so the frontal lobe, the front part of the brain is damaged, even if you have 10 residents with the almost the exact same accident with almost exactly the same brain damage, how that affects each and every one of them is going to be unique and different. Now, I know this goes without saying. For 13 years running buildings, I know how good you are as caregivers at really, really getting to know, right? Getting to know your resident individually, especially residents with dementia. You know what to say, what not to say. You know how to approach them. You know what's going to get you in trouble with them. You learn these things about them individually. And that is as true as ever. Okay, when you're working with somebody with traumatic brain injury with that type or that cause of dementia, you want to make sure that you're getting to know them as an individual. All right, guys, I got another video for you. Let's talk a little bit about that talks a little bit about the symptoms of TBI.
Our son got hit in the football game and had to enter the concussion protocol. He was emotional, confused, and nauseous for a few weeks before he looked like himself again.
I hit my head on the sidewalk, but I don't remember falling. I remember being in the ambulance after, but that's all.
My fiance was in an explosion in combat. When he returned, he had trouble finding words, organizing his thoughts, and paying attention to conversations. It was so hard for him.
I hit my head on a steel beam at work and it knocked me out. I had to stay home for 2 weeks. Lights and noise really bothered me, and I didn't feel well at all.
These are the voices of people who experienced a traumatic brain injury, and the voices of people who care about them. Traumatic brain injury, or TBI, is a common injury, and people can experience effects that last anywhere from a few hours to their entire lifetime. In some instances, TBI can be deadly. Knowing signs and symptoms of TBI and knowing when to call for help empowers family and friends to make a difference. TBI is caused by a blow to the head that causes the brain to have problems functioning. Many people experience bumps or jolts and don't end up with TBI. Brain injuries can be mild, moderate, or severe. The vast majority of TBIs are mild and are commonly known as concussions. Most people who suffer a concussion recover completely, although people are at risk for more problems if they hit their heads again, especially if they're still recovering from the first concussion. Signs of a concussion generally are seen in 4 areas. Physical. People sometimes experience nausea or vomiting after concussions. They may feel dizzy and sensitive to light and sound. They may also have headaches and be really tired. These symptoms may only last for hours, but can sometimes continue for days or even weeks. Emotional. People who have concussions can sometimes experience intense emotions. They may cry easily and feel depressed, irritable, or anxious. Thinking and remembering. People may have trouble thinking clearly. They may have trouble remembering new information or concentrating on tasks or conversations. Some people say they feel like they're in slow motion. Sleep. After a concussion, people may sleep a lot more or a lot less than usual. TBIs can also be diagnosed as moderate or severe. This depends on how long people are unconscious and by medical tests done by doctors after the injury. Any head injury can be dangerous, and getting medical attention is always encouraged. Definitely get emergency medical attention if someone is unconscious, confusioned, has seizures or slurred speech, if they keep vomiting, or if they feel numb or weak. The type and duration of treatment for TBI depends on how bad the injury is. A mild TBI or concussion often benefits from rest and time. Treatment for moderate or severe TBI is typically a combination of physical, occupational, and cognitive therapy that helps people find new ways of thinking, planning, and completing activities. Neuropsychologists are often involved in testing. and creating rehabilitation plans based on the areas of the brain that are injured. Families are an important part of treatment success, and there are many ways to support people who have lived through TBI. Traumatic brain injury can impact people's lives in many ways, from a few symptoms lasting only hours to a lifetime of disability. Head injuries are common, and the hours and days afterward can be scary. But if you know the signs of TBI and get prompt medical treatment, people often recover from TBI, returning to the lives they've always lived. For those with TBI, with treatment comes hope.
Sorry, couldn't find the unmute button. All right. So again, we have a better idea, right? Just of some of the common symptoms that we might see, right? So the video kind of talks about it. I'm not going to spend too much time on this slide. Obviously, the headaches and the dizziness. Now, what's really important for you guys, again, as caregivers, where these symptoms become really important for you, don't get me wrong, you have somebody who's already experienced TBI. They've been to the hospital, they've been to the skilled nursing, they have permanent traumatic brain injury or permanent brain damage. In other words, their symptoms are going to be permanent. Yes, you're going to get, and the reason why we're doing this training is specifically for those residents that you're going to be able to accept and move in that have that permanent damage. But for you caregivers, I need you to also consider that with our seniors, fall is the number one cause of of a traumatic brain injury. We need to be able to recognize and think about how often do we have unwitnessed falls in our home, right? In our community. Unfortunately, sadly, it happens all the time. And so, I've had residents, I've had in my assisted living neighborhoods, I've had seniors fall in their room, and the only reason why we know about it is because they told us about it. And so anytime we get that report, even though it doesn't appear that they have any injury, then we need to make sure that we're monitoring them for a little while, right? Are they complaining of headaches? Are they complaining of, light sensitivity? The bright lights are bothering my eyes. Are they feeling nauseous? Has it affected their appetite? Maybe they're not throwing up, maybe they're not vomiting, but they're feeling nauseous, or you notice they're not eating. They haven't been eating like they normally have. And this is what I love about caregivers, because you guys get this stuff. You get to know your residents so well that you see these subtle changes. And the point that I'm trying to make is that, especially when we know that somebody's had a recent fall, we just need to pay just a little bit more attention, right? Just to watch for those symptoms. Sorry, I realized that my other office chair is showing up in my virtual background. There we go. Okay, fatigue. Fatigue is very common with traumatic brain injury. They just run out of gas earlier in the day, or they need more frequent naps throughout the day. Okay. Now think about it, guys. Our brain, when we sleep at night, our brain requires, not only our brain, our body, our cells, everything, it requires the third and fourth stages of sleep. Okay. Which affects our circadian rhythm, and then our REM phase of sleep. You probably heard of this, rapid eye movement, or the REM phase of sleep. It's those phases of sleep that allow our brain and our body to rejuvenate. And so frequent napping throughout the day is not uncommon for somebody with TBI, because it's basically recharging their battery, right? It's recharging the battery. Our brain essentially is kind of like a battery, and it can run out of gas, it can run out of juice. So napping again is very common. We talked a little bit about the nausea, vomiting, sensory changes, sleep issues. It might, and that's the sad thing. The scary thing is that it can actually affect the traumatic brain injury, can actually affect or create or cause sleep disturbances. So it's kind of, the brain unfortunately is working against itself. And then more severe signs might be things like seizures when they don't have a history of seizures, slurred speech, unequal pupils, right? If one pupil looks more dilated than the other, or if there's any clear fluid discharge from either the ears or the nose, right? That's serious stuff. Obviously, we have the cognitive symptoms, confusion, disoriented, foggy, right? That brain fog. They may have difficulty with memory or concentrating, trouble remembering things, focusing, watching them during their activities. Are they not able to stay, engaged, involved in more than usual? Mood changes. They could get irritable, anxious, depressed. They may get easily agitated. Okay. And slow thinking, right? Unfortunately, their brain is processing or is no longer able to process information as quickly as before, or some information they may not be able to process at all. Okay. So again, let's talk about, especially when the frontal lobe or the front part of the brain is damaged, it can often cause mood disorders. So let's go ahead and watch this video about mood disorders.
Hello, my name is Dr. Alina Fong, and I'm a clinical neuropsychologist and the clinic director here at Cognitive FX. We often get asked, why do we as patients experience significant personality and mood changes after a concussion? Personality changes and mood changes are very common after traumatic brain injury, and even a concussion can cause lasting effects. The wonderful reality is that many of these personality changes and mood symptoms can go away if you get the right treatment. Often these effects are multifactorial in nature, but they can also come secondarily from feelings of hopelessness and helplessness that has occurred after this concussion. What are some of the common emotional symptoms that patients experience? First and foremost is anger and irritability. We have so many patients and even family members that report an increase in short-temperedness. Another common symptom is anxiety. Post-traumatic stress disorder can come hand in hand after especially a more traumatic type of concussion like a motor vehicle accident or something like that. But increased anxiety is very, very common. Often these patients have not experienced clinical or an official diagnosis of anxiety or depression before the injury, but after the injury they do meet these clinical diagnoses. But these are real issues that our patients are dealing with that lead to more isolation. And when you combine more social isolation with depression and those feelings that are already there, that can actually lead to more significant issues like more suicidal ideation and those thoughts and feelings that we have to be very careful of. It's important to find a psychologist who is well trained specifically with anxiety and post-traumatic stress disorder. So the next question is, what do you do with these emotions and where can you get help? First thing is to identify your triggers. Oftentimes it could be for post-traumatic stress disorder, perhaps driving or any type of activity or location or topic that was associated with that accident at that time. So identifying these triggers is the first step in learning how to deal with them. Secondly is asking a family member or someone you love for help. Family members can provide great insight and they love us and they are wanting what's best for us. If you are aware of your triggers and you have help from family members, you may ask them for further help to figure out what's the best ways to calm you down. For some people, it could be going for a walk. For some people, it could be coloring, but you need to find ways yourself to help you calm down and destimulate. Another tip would be to get some exercise. We are finding that cardiovascular exertion, getting vitamin D, getting out in the open are some of the best ways to combat not just depression, but concussion symptoms overall. Above all, it is imperative that you find the right treatment. No two brain injuries are alike, and each individual has their own symptoms. This is why it's so important to utilize different advanced neuroimaging techniques in order for us to map your brain and to see what parts of your brain are working overtime or hyperactivating and neurally compensating for other parts of your brain that may not be working properly at all. It is important for us to see this as an overview and for us to then tailor your treatment for your individual brain injury. Some of these areas we find will be directly tied to these depression symptoms or anxiety symptoms. Luckily, we can provide that comprehensive care for you. If you are still struggling and you still want more answers, please contact us and set up a no-charge complimentary consultation. We would be happy to listen to your symptoms and see if you would be a good fit for our treatment and if we'd be a good fit for you. For more information, please visit our blog. There's a link in the description below.
Okay, so what I really like about the video, obviously, as a memory care, we're not going to be providing the kind of treatment that they're talking about. But what I really like about the video and why I included it in the training is because it does talk a lot about what we, as the care provider, as the person who's assisting them in their day-to-day, what are some day-to-day things that we can do to help them? But obviously, also so that we understand, what may be involved in their ongoing treatment. If they're going out, if they're going, whether it be therapy, whether it be physical therapy, we can see, what other services that may be beneficial, because ultimately we're always advocates, right? We're always advocates for our residents, for our clients. All right, so let's talk a little bit about our role and what are some things that, can help us as caregivers, as, providing the care and supervision. So not everyone with TBI displays obvious signs of a disability. We talked about that, right? Just because you don't see a bump on their head, let's not just assume, oh, well, I can't see. You don't look like you got brain damage. Well, what does that look like, right? Since their TBI may affect their cognition or their cognitive, physical, and or emotional functioning, each resident will have his or her own unique set of symptoms. So we were kind of talking about that before, right? Although the most common mood shifts tend to be agitation or aggression, no two brain injuries result in the same set of symptoms. So again, just kind of re-emphasizing what I said before. We have to get to know them as individuals, okay? So what are some tips that can help us as care providers? Regardless of the nature of the symptoms, there are some broad accommodations that caregivers should consider when we support residents and clients with traumatic brain injury. First of all, keeping things organized. Make sure to keep the home organized. Be conscious of where items are usually kept so as not to confuse them. So I'll tell you guys, my entire life, not just because I'm getting old, but my entire life, I've always had not the greatest memory. Well, let's just put it that way. And so one of the things that I learned, I'm a father of four. I got 4 kids, okay? Now, my kids are older. My baby, my youngest is 19. So, and she's the only one who lives here at home with us. But when my kids were growing up, you can imagine with 4 kids, come on, the house was not always the neatest. Okay, it wasn't always a tidy home. And so because I know what I knew always known about myself is I don't have the best memory. So dad had his section. Okay, he had his not even a. Come on, it's a family of six. I didn't even have a section. I had a little spot. Okay, but my wallet, my keys, maybe my eye drops because I wear contacts. The things that I took that I keep in my pocket, my pockets all the time. When I got home from work or when I went to wind down, my wallet, my keys, my eye drops always went in the same spot. And as messy as that house may have gotten at times, the kids knew don't touch dad's spot. And you know what? I never lost my keys. I never lost my wallet. Why? Because I had a designated space for it. Now, I'm not saying that, like I said, the rest of the house may not have been organized, but dad always knew where to find his keys. He always knew where to find his wallet. So if I turn my camera around, guys, if you could see my desk, you would cover your eyes. Okay. I call it organized chaos. I call it organized chaos because if I see Maria, I see you smiling at my comment about my messy desk. If I sent Maria to go get something off my desk, it would take her forever to find it because my mess, my desk, my mess, okay, it would take her a while to find it. But me, I know exactly where to find my business cards. I know exactly where I can find a pen. I know exactly where I can find notepads. Okay, that's what I mean by organized chaos. Now, I don't have dementia. I don't have traumatic brain injury. So even though visually it looks like chaos, in my brain, in my mind, I'm able to organize that. And most of us can do that, right? For somebody with traumatic brain injury, they can't. They can't always. This is a common symptom. So it's important that we keep things organized. It's important that we keep things, they kind of have their own place so that that person with traumatic brain injury, they don't struggle with having to figure out or having to find something every time they look for it. So keeping things organized is really helpful. Maintain their routine, keep their day-to-day lives as consistent as possible. This will be helpful for memory issues and prevent them from getting overwhelmed. If there's going to be a deviation or a permanent change from the typical routine, discuss it with the resident beforehand. Prepare them for it, okay? And the other thing, and this is always a balance. There's always a balance. And you guys know, having worked with, with dementia, people with dementia, you know that sometimes they'll get anxious. Letting them know about a change is going to create anxiety. Okay, what I learned, my mother-in-law is 95. And actually, she doesn't have dementia. She's pretty sharp. Okay, for 95, she's pretty darn sharp. If there's going to be a change in the routine, we'll usually tell her like either right, depending on what it is, how big it is, how big the event is, we might not even tell her till the last minute. Now, we'll discuss it with her, we'll talk to her about it, but if we know, no matter how much we talk about it, it's still going to create anxiety, we might wait. Okay, whereas other times, there's like, so my sweetheart and I, my wife and I'm remarried, okay? I'm one of those lucky guys who got a second chance on love. We were married about a year and a half ago. Well, we didn't have the opportunity to take a full honeymoon. So we took a mini moon, right? We took a long weekend. Well, because she's on hospice, we were able to get her in a respite stay. We were able to get her to be able to stay in a skilled nursing for 5 days so that we could go celebrate our new wedding, our new marriage. Oh my gosh, that was really stressful for her. So we tried to give her a little bit of warning. This one we talked to her about, a few days earlier, to help her acclimate to get used to the idea. But we didn't want it. We knew 2, 3 weeks in advance, right? We knew what we were doing. Actually, we knew longer than that. So again, this is where you need to get to know your resident individually and what's going to work best for them and how you let them know about these changes. Be patient. I know this goes without saying. Allow your resident as much time as necessary to complete tasks. It can be frustrating, but it's important to encourage them to work through their activities at their own pace. Come on, you and I both know it's faster and easier if you do it for them. Don't. Refrain. Take a deep breath. It's important that you let them do it at their pace. Okay. And so the best way for you to not go crazy, because you've got 2 other residents that you have to bathe, that you have to shower before breakfast. Okay. You need to anticipate that they're going to need that extra time. And so make sure that you go in. If I walk into your room, right, and you've got traumatic brain injury or even another type of dementia, okay, we've got 5 minutes. We got 5 minutes. Let's go, let's go, let's go, let's go. Good luck. And you guys know this. Again, I'm not telling you anything you don't already know. Help them develop strategies. People with TBIs can be very frustrated. They can become very frustrated due to memory loss, even fatigue. Help the client or the resident help them develop helpful techniques that they can depend on. Examples might be notebooks, calendars, alarms, etc., that can provide cues and reminders. So, guys, I was telling you about my 19-year-old, right? That's my baby. That's my youngest. That's our youngest. We're helping her transition into adulthood. She graduated high school last year. Now she's, in college, working, she's becoming an adult. Well, she didn't live with me. Like when her mother and I, when the mother of my children and I separated and divorced, this was 10 years ago. So she was only 9 years old and she lived full time with her mom. So I've only had her, she's only lived with me the last 2.5 years. So I'm trying to play catch up with her and helping her learn how to be an adult, right? How to do this adult thing. And I find myself having to, I can't just give her all the answers. I can't solve all of her problems for her. I have to teach her and give her the opportunity to learn. But I can give helpful techniques. If you're always late, have you considered, you have a phone, you could, that iPhone you're holding, you can set 20 alarms if that's what you need to do. I hate to say it, guys, and I'm not 19, but I have about 6 alarms set for, my daily stuff. So again, help them learn to be problem solvers. Understand their fatigue. We talked about this. People suffering with brain trauma can easily become exhausted, particularly during recovery stages and when undergoing multiple forms of therapy, for example, physical, occupational, and speech therapy. Understanding their stage of the healing process and catering support to their current needs is important for their care. Guys, I do recognize the time. With roll call and everything, just a few more minutes, okay? Stick with me. Support them psychologically. Caregivers are in an ideal position to identify what improves quality of life for someone with TBI. Focusing on their personal goals, despite mood changes and physical symptoms, can help the client or the resident feel fulfilled, even after the brain injury limits what they can do. For example, assisting with interpersonal and relationship building goals is also important for his or her overall emotional well-being. So sometimes boundaries, right? Again, the brain damage could affect our ability to kind of recognize and hold boundaries. And so, helping them with that, providing them or supporting them with social skills, interactive skills. And so, guys, we're almost at the end. I do have a 5-minute video. What I really like about this video, guys, it's hearing what it's like to have TBI from a person who has traumatic brain injury and what it's like living with it. And so let's watch that, and then we're just about done. After that, we'll wrap it up.
The Invisible Rain Cloud, a short story about traumatic brain injury. People sometimes ask me what it's like living with a brain injury. It can be difficult to explain, but let me try. Imagine one day you woke up in a foreign country. Everything looked similar, but slightly different. You recognized your friends, your family and loved ones, but when they spoke to you, it seemed like they were talking in a different language. You're not really sure how you got here, you certainly didn't ask to come, and you wish you could just go home. Suddenly the familiar seems unfamiliar, and that's a truly scary thing. Imagine your favourite hobbies and activities. Things you used to do every day and took for granted, suddenly seeming impossible. Simple tasks that you learned when you were a child, somehow unlearned overnight. Imagine how helpless that would make you feel. Sometimes it feels like I have a personal rain cloud that won't go away. It follows me around, dampening my enjoyment of life and making even the sunniest of days seem cold and grey. Some days it's higher in the sky, some days it feels like it's smothering me, like I could reach out above my head and touch it. But high or low, it's always there. The hardest part? No one else can see the cloud. To them, I look just the same as I did before my injury. My cloud is invisible. My brain injury is invisible. My friends ask me how I feel, and they try to understand. They tell me that they forget things too. I know they mean well, but sometimes I find it difficult to hear. And I get angry. My rain cloud can turn into a thundercloud in an instant. A thundercloud that rages against the people who are most dear to me. After a while, they stop asking, and that makes me feel even more alone. When I tell people about my accident, they tell me that I'm lucky to have survived. I don't feel lucky. Lucky is winning the lottery. Lucky is good. I feel there is nothing good about what happened to me. There are even moments when I wish that I hadn't survived. But fortunately, my cloud lifts just a little and those moments pass. Although I know for some others, they don't. I miss my old life. I miss the old me. I miss not being in pain, not forgetting things, not being confused, not feeling angry for no reason. But I'm trying hard to accept the old me won't be coming back, that the new me is here to stay. I've found that talking to others who are living with a traumatic brain injury has helped. Every brain injury is different, and everyone will experience their injury in a unique way. But talking to those who are going through similar changes in their lives has helped me realise that I am not alone. Their clouds are not invisible to me, and they can see my cloud too. We help each other to keep them high in the sky where they belong. I've also found that picking up hobbies and activities I enjoyed before my injury helps me remember that deep down inside, I'm still me. I find resilience and strength in the small victories, and I've learned that the simple things in life that we all take for granted are a huge part of what makes us who we are. There is life after brain injury, and I know that with time, patience, love and support, the new me will be okay. Thank you for listening to my story.
Okay. So again, really hearing about it from their perspective, I hope you enjoy that. Like I said, I do. I really enjoy hearing that perspective. I think it helps with empathy, help us trying to put ourselves in their shoes. The last part, guys, again, is just understanding the risk. Okay, so as far as your administrators go, or the leaders in your building that determine who moves into your building, the first step really is to determine whether or not that resident with TBI is really appropriate for your home by gaining a thorough understanding of his or her unique symptoms, and that only comes through a very thorough needs appraisal. Okay. It's also looking at whether or not the team are appropriately trained to meet those unique care needs. And if not, then maybe we need a little training, right? It doesn't necessarily mean that, oh, well, we can't accept them. But the fact of the matter is, you guys are already very, very skilled. You're well trained when it comes to dementia care. The vast majority of what you're going to see with somebody with traumatic brain injury, you're already used to, you've already done, and you're very capable. The care team must really get to know that resident and the most effective interventions to which the resident responds, right? And again, especially with memory care, you did that already. And guys, with all memory care, right? It's trial and error. When an intervention doesn't work, you back up and you try something else. When that doesn't work, you back up and you try something else, right? And you might try 3 or 4 different approaches. If that doesn't work, maybe I back off and say, I give it a couple of minutes. I say, hey, Lakeisha, can you do me a favor? Can you go check out Jethro? I've tried getting him in the shower 3 times and he's just not having it with me. Maybe you'll have better luck than I will. So, and you guys know this process. You know how it works. And then lastly, and it's not just your administrators that say this. I'm saying it too. Document, document, document. All right. I know that's not why we became caregivers. We didn't become caregivers to write it all down. It's kind of what I call the necessary evil. But yeah, guys, we got to document. Okay. The good, the bad, and the ugly. We got to document it. So this slide, guys, is really just some additional resources. If you want more information, most of these places also have websites that you can, again, do a little bit of research. If you need to do additional training, want additional information, additional support, there you go. And with that, the last slides really don't mean anything. So I'm gonna leave it at that. Really quick, everybody is muted. But before I stop recording, are there any questions? Feel free to unmute yourself if you have any questions. Y'all are quiet. Y'all just need to get back to work. I get it. I understand and I respect that. So what we're going to do, guys, first and foremost, let me stop recording.